I'm Elena Polokis, and this is class MUW-NU 361. Today I'm going to be doing my physical assessment. This is my patient Lacey. Do you consent for me to assess you? And you also have the right to refuse treatment if so. Okay. So we're going to go ahead and get started with her physical assessment. First, I'm going to start out by assessing her face for any blemishes and making sure it's symmetric. I don't notice any blemishes and it is symmetric. So next I'm going to palpate her scalp and inspect her scalp and palpate her cranium. I don't notice any nodules and her scalp is not dry. Okay, so now my patient, her effect, she has a joyful mood. So next I'm going to palpate her temporal arteries one by one. Okay, so now I'm going to palpate her tempomandibular joint. And by doing this, I'm going to ask the patient to open and close her mouth. Okay, there's no popping noted. So now I'm going to test the strength of her jaw, which is cranial nerve 5, and her sensory function. Can you please open your mouth against resistance? Okay. Her strength is good, so now I'm going to get a cotton wisp and test her sensory function. Okay, sensory function is intact, so now I'm going to assess cranial nerve 7. Can you please smile for me? Frown, close your eyes, raise your eyebrows, show your teeth, and puff your cheeks out. Okay? Cranial nerve 7's function is intact. So now I'm going to assess cranial nerve 2, and I'm going to use the Snellen chart, which I have right here. I'm going to go walk 20 feet away and ask her to read. Can you cover your right eye and read line 6?
E-E-W-W-M-E-E.
Okay, now can you cover your left eye and read line 6?
E-E-W-W-M-E-E.
Okay. Patient has 20/20 vision according to the Snellen chart. So next I'm going to move on and assess cranial nerve 3, 4, and 5. And I'm going to assess the vision field acuity. So now I'm going to ask her to follow my pen. Okay. The patient's visual acuity is intact in the 6 fields. And I'm also going to check the same cranial nerves and check the pupils. Okay. Okay. Her pupils are equal, round, and reactive to light. They're accommodated to light, and they're 3 millimeters in size. And they're equal bilaterally. And I tested, when I was looking at her pupils, I tested for accommodation to light. So now I'm going to inspect and palpate her eyebrows, eyelids, lashes, and eyeballs. Okay, those look normal and symmetrical. There's no discoloration, redness, or swelling noted. So now I'm going to inspect her conjunctiva, her sclera, her corneas, and her irises. Okay, they are regular, there's no discoloration, and they're equal bilaterally. So now I'm going to move on to her ears. I'm going to inspect and palpate them. Okay, her ears are bilaterally equal. There's no drainage or anything. So now I'm going to assess her cranial nerve 8, and I'm going to do that by whispering.
Can you tell me what's for lunch? Patrick and Tyler are outside.
Okay. Now, she passed cranial nerve 8. That's intact. So now I'm going to look at her nose, and I'm going to inspect and palpate and make sure there's no irregularities to her nose, and it's equal and symmetric. So now I'm going to check the patency of her nostrils. Can you please sniff? Sniff. Okay, her nostrils are patent. So now I'm going to palpate her sinuses. And I'm going to palpate her mandibular and her temporal. Or her frontal, not her temporal. And her maxillary. Maxillary and frontal. Okay? Her sinuses are good, there's nothing including, and they're not swelling. So now I'm going to get a pen light, and I'm going to inspect her mucous membranes, her teeth, her gum, her tongue, her floor of her mouth, her roof of her mouth, her palate, her pharynx, and her uvula. Lift your tongue up. Up. Okay. Her mouth is pink and moist. There's nothing irregular noted. She has no tonsils, so they're not present. Now I'm going to ask you. Let me get my tongue depressor out. And I'm going to test cranial nerve 9 and 10. And I'm going to ask the patient to stick her tongue out and say, ah. Okay. Her gag reflex is present and her uvula is mobile. Now I'm going to test cranial nerve 12. Can you please stick your tongue out for me again? Okay, it's symmetric, so cranial nerve 12 is intact. So next, I'm going to palpate her lymph nodes and make sure there's no swelling or anything irregular. I'm going to palpate her preocular, her post-articular, her occipital, her submental, her submandibular, her tonsillar, her superficial cervical, her post-cervical, deep cervical, and subclavicular. Make sure you get those post ones. Okay, now make sure to not miss those clavicle ones. Okay, everything is normal with her lymph nodes. There's no swelling noted, and there's no tenderness with that palpation. Now I'm going to test cranial nerve 11. Can you please move your chin to your chest, and then head side to side, and then touch ear to each shoulder, then extend your neck back. Now I'm going to ask you to move your head side to side with resistance. Okay, and now can you shrug your shoulders against resistance? Okay, the patient's streak is present bilaterally. There's no irregularity with a range of motion to her neck. Now I'm going to palpate her trachea and her thyroid. Okay, there's nothing abnormal noted about that. There's no swelling or tenderness. Now I'm going to inspect and palpate her carotid, one side at a time. Okay, so now I was able to palpate that. Now I'm going to auscultate for carotid bruits. Both sides. Okay, bruits are not present, and those pulses are +2 bilaterally. So now I'm going to ask my patient to sit in this chair, and I'm going to inspect her chest wall. No, no, Okay? Yeah. I'm going to inspect her back, her posterior chest wall, and I'm going to palpate it and make sure I don't feel anything out of the ordinary. And now I'm going to test her tactile fremitus. So I'm going to put my hands at the base of her lungs and ask her to talk. What are they doing? Okay, her tactile fremitus is present and symmetric. So now I'm going to percuss her posterior lung fields. Okay, everything's normal with that. So now I'm going to percuss her CVA tenderness for flank tenderness. Okay, it was not tender for the patient, so now I'm going to auscultate her lung sounds. And there's 9 fields. Breathe in for me and out. In and out. In and out. In and out. Out. Okay. In and out. In and out. In. Okay, her lung fields are clear bilaterally. So now I'm going to move on to her upper extremities. If you'll sit on the couch again. Okay, scoot. I'm going to inspect, and now I'm going to palpate her arms. Okay, there's no lumps or nodules I feel, and they're symmetric. So now I'm going to assess her pulses. Start their brachial. Her radial. And then her ulnar. Pulses are +2 bilaterally, so now I'm going to move on to her cap refill. Okay, our cap refill is less than 3 seconds bilaterally. So now I'm going to ask her to do a little range of motion on her shoulders. Can you please raise your arms like above your head? Can you put them behind your back? And can you adduct and abduct? Okay, her range of motion is good in her shoulders. So now I'm going to ask her to flex and extend her elbows. Act like you have a bowl of soup in your hands and pour it. Okay? Now, I'm going to need you to flex and extend against resistance. Okay? Okay? Flex and extend. Okay. Her strength is good bilaterally and her range of motion is good with her elbows. So now I'm going to test her range of motion with her wrists, hands, and fingers. Make a fist for me. Okay? Spread your hands, close your fingers. Now touch each finger to your thumb. Okay? Her range of motion in her wrists and hands and fingers are normal bilaterally. So now I'm going to ask her to take her finger to her nose, and that's testing her cerebellar function. Her function is intact. So now I'm going to test her graphesthesia. So can you please close your eyes for me and put your palms out, and can you tell me what I'm drawing? Okay, perfect. So now I'm going to test her sterigenosis. So will you please close your eyes for me? Can you tell me what that is? Okay. And can you tell me what that is? Okay, perfect. Her diagnosis and her gastrosthesis is both intact. So now I'm going to test her tricep, bicep, and brachial reflexes. Okay. All three reflexes are intact. So now I'm going to assess her and make sure her worker breathing is normal. She's not struggling, so her worker breathing is normal. Now I'm going to ask the patient to lay supine 45 degrees. Can you lay this way? Actually, lay that way. Okay, and I'm going to inspect her heart, her pericardium area. There are no heaves or lifts in this area. So now I'm going to palpate her PMI and feel for the outward tap. Okay, I palpated her PMI and I felt that outward tap. So now I'm going to palpate for pulsations. Okay, I feel no pulsations, so now I'm going to begin listening to the heart. I'm going to listen with the belt and the diaphragm. I'm going to first listen with my diaphragm. I'm going to do aortic, pulmonic, Erb's point, mitral, then I'm going to go back up to the tricuspid, and then I'm going to listen to her apical. Okay, now I'm going to listen to all of those with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral, and her aortic, or apical. Sorry. I'm gonna make sure to listen to that apical for a full minute. Okay, heart sounds, regular rate and rhythm on all lung or heart fields. I didn't notice anything abnormal like a murmur. And now I'm going to start to inspect her abdomen. If you please lay down, scooch. Okay. I'm inspecting her abdomen. I don't notice anything with her skin. It looks normal, no discoloration. And now I'm inspecting for visible peristalsis, symmetry, and pulsations. I don't see any of that. Her abdomen looks normal. So now I'm inspecting the umbilical also for hernias. I don't see any hernias. So I'm going to begin to listen to her bowels. I'm going to listen in all four quadrants. Okay, her bowel sounds are normal active. So now I'm going to begin to listen to her aorta and renal arteries. Okay, those are both present and they're equal bilaterally. So now I'm going to begin to percuss the abdomen. And in all 4 quadrants. Okay, that's normal. So now I'm going to do light palpation in the 4 quadrants. Okay, I don't notice any masses or bulging. I'm going to do deep palpation and see if she experiences any pain or tenderness. Okay, everything's normal with deep palpation too. So now I'm going to palpate her liver. So I'm going to put her right hand under, left hand over. Okay, I palpated the liver and everything's normal with her liver. Okay, so now I'm going to move on to her lower extremities. I'm inspecting and I'm palpating and I'm just looking. I noticed nothing abnormal with her lower extremities, no discoloration, they're symmetric. So now I'm going to begin to palpate her pulses, her popliteal, her posterior tibial, and her dorsalis pedis. Okay, her pulses were +2 bilaterally. So now I'm going to palpate for pretibial edema, no edema is noted. So now I'm going to ask my patient to stand, please. Okay, now I'm going to test her range of motion on her hips, leg, and knees. Can you please raise your knee to a 90-degree angle on both sides? Okay, can you bend your knees to your chest? And can you rotate your hips in and out? And that was her abduction and adduction. So her range of motion in her lower extremities is good. Now can you sit back down? I'm going to, can you plantar and dorsiflexing your foot, which is pulling your feet back and pushing them out. Okay, so now I'm going to get down here, and can you do that against resistance? Yes, on both sides. So her range of motion in her feet are good and equal bilaterally, and her strength is good, but now can you invert and evert your foot? Yes, yes. So her foot range of motion is good. So now I'm going to rate her patellar, Babinski, and her Achilles reflexes. Okay? Okay, all of her reflexes are present. So now I'm going to test your cerebellar function. Can you please rub your right heel down your left leg? Okay, her cerebellar function is intact. So now I'm going to ask you to stand again. Sorry. And can you please walk on your heels and then walk on your toes? Okay, now I'm going to perform what's called the Romberg's test. Can you please close your eyes with your feet together, and I'm observing her for any unsteadiness or loss of balance. Okay, you can open your eyes now. The patient experienced none of that, so that is intact. So now I'm going to ask you to hop on one leg. I'm assessing her muscle strength and her cerebellar function. Both are intact and strong. So now I'm going to begin to palpate her spine and inspect it. Okay. No abnormalities noticed with the spine during inspection and palpation. So now I'm going to ask you to bend forward. Okay. And now can you bend to both sides? And now can you bend back? And can you twist to both sides? Okay. So her spinal range of motion, you can sit back down. Her spinal range of motion is intact, and that concludes my physical assessment. And my patient was normal throughout the physical assessment, and there's nothing abnormal noted. That's it. Thank you.